Doctor, please can explain what ectopic pregnancy is.
Pregnancy begins with a fertilized egg. Normally, the fertilized egg attaches to the lining of the uterus. An ectopic pregnancy occurs when a fertilized egg implants and grows outside the main cavity of the uterus. An ectopic pregnancy most often occurs in a fallopian tube, which carries eggs from the ovaries to the uterus. This type of ectopic pregnancy is called a tubal pregnancy. Sometimes, an ectopic pregnancy occurs in other areas of the body, such as the ovary, abdominal cavity, or the lower part of the uterus, cervix, which connects to the vagina.
Can ectopic pregnancy survive?
An ectopic pregnancy can't proceed normally. The fertilized egg can't survive, and the growing tissue may cause life-threatening bleeding if left untreated.
Is there any symptoms at all?
You may not notice any symptoms at first. However, some women who have an ectopic pregnancy have the usual early signs or symptoms of pregnancy: a missed period, breast tenderness, and nausea. If you take a pregnancy test, the result will be positive. Still, an ectopic pregnancy can't continue as normal. As the fertilized egg grows in the improper place, signs and symptoms become more noticeable. However, one of the major signs of ectopic pregnancy is light vagina bleeding and pelvic pain. If blood leaks from the fallopian tube, you may feel shoulder pain or an urge to have a bowel movement. Your specific symptoms depend on where the blood collects and which nerves are irritated. Please see a doctor when you have abdominal pain or pelvic pain, shoulder pain, or when you start fainting.
Okay, doctor, but what causes this?
The most common type ectopic pregnancy happens when a fertilized egg gets stuck on its way to the uterus, often because the fallopian tube is damaged by inflammation. Hormonal imbalances or abnormal development of the fertilized egg also might play a role.
What are the risk factors?
Some things that make you more likely to have an ectopic pregnancy are: 1. Previous ectopic pregnancy. If you've had this type of pregnancy before, you're more likely to have another. 2. Inflammation or infection. 3. Fertility treatments. Some research suggests that women who have in vitro fertilization, IVF, or similar treatments are more likely to have an ectopic pregnancy. 4. Infertility itself may also raise your risk. 5. Tubal surgery. Surgery to correct a closed or damaged fallopian tube can increase the risk of an ectopic pregnancy. 6. Tubal ligation, a permanent method of birth control, commonly known as having your tubes tied, also raises your risk if you become pregnant after this procedure. 7. Smoking. Cigarette smoking just before you get pregnant can increase the risk of an ectopic pregnancy. The more you smoke, the greater the risk.
But how can I prevent it?
There's no way to prevent an ectopic pregnancy, but here are some ways to decrease your risk. 1. Limiting the number of sexual partners and using a condom during sex helps to prevent sexually transmitted infections and may reduce the risk of pelvic inflammatory disease. 2. Don't smoke. If you do, quit before you try to get pregnant.
Thank you, doctor. I really appreciate